Good morning, everyone. This is a short demonstration about apical gauging and how to adjust your GP to fit the canal properly and prevent extrusion of the GP point. Now, my favorite GPs, or the most common GPs I use, is 2506 because I predominantly use two systems with variable taper, which is Wave 1 Gold and Reciproc, which is 2507 and 2508. But sometimes I'll have to go to a file and to an instrument which is slightly wider, especially in palatal canals of the upper sixes. I use two different kinds of gauges. This is one of the most simplest ones, and as you can see, it has different gauge nomenclatures, and beside it you've got these slight tiny holes. The only disadvantage of this is I have to use a separate scalpel to cut off the tip. I generally don't use scissors for a simple reason. The GPs will open up. They won't look nice. They won't be, perfect fit. Now, this is my most favorite one. This again is by Cyber Endo. If you look at it, it has all these numbers around 25, 30 and 40. The best bit is you have this. This is like a little scalpel. And this is like a pot which accumulates all the tips. Now, just for demonstration purposes, I'm going to use a 2506 GP. Now, this GP, after you've gauged the apex with the apex locator and you decided, okay, the apical diameter of the palatal root is around 40, and I generally do not tend to just stick a 40 GP right in for simple reasons. None of these GPs actually coincide with what they say. So I use a standardized GP. I go in, rotate this to size 40, put this GP point in, and it holds like this, and I just slide this blade. So that now is a 4006, and this will perfectly fit with a tuck back into that gauged apical area. Thank you for listening. Have a lovely day.